Okay, great. So again, welcome to our discussion today. I'm Dr. Charlene Brown, the founder of CNA Simulations, and we are bringing together some of the brilliant nursing assistant instructor minds that are behind our CNA simulation content to share some of their insights. Today, we will begin with the agenda. Okay, so I'm going to go ahead and introduce Jennifer and Danielle. Then we'll do a brief demo of the product for those who haven't seen it yet. And then we're going to have the instructors really dig into 5 core areas: communication, real-time feedback, safety, critical thinking, and competence. We're going to learn about how they construct the simulations to enhance students' learning and ability to exercise and practice in these areas and more. We'll have an open Q&A section and then talk about what's coming next month. I also want to highlight that we have Celine Champagne in the audience, and she also used to work with CNA Simulations, helping to build content and did some research on our simulations. So welcome. Okay. Jennifer DeRose-Barjar is an RN with more than 20 years of experience as a CNA instructor for high school students in the state that we both live in, which is Maryland. She is a nurse educator who worked for the Anne Arundel Medical Center, where she developed the first PCT, or patient care technician program, in Maryland. She served as a nurse aid evaluator, a nursing assistant clinical instructor for the same county's community college. She earned her master's in nursing and her MSN and her Maryland Department of Education teaching certificate, and proceeded to spend many years co-designing and teaching LPN, certified nursing assistant, geriatric nursing assistant, and medical assistant programs. She served as the county representative on the Maryland, one of the leadership committees with the Maryland Academy of Health Professions, and overall just experiences a lot of joy and satisfaction with being able to have an impact on the lives of both patients and residents and those who are pursuing education as nursing assistants. Danielle Young is an RNA with more than 14 years of experience, an RN, sorry, not an RNA, an RN with more than 14 years of experience as a CNA instructor in Kansas and more than 20 years of experience in geriatric nursing. She's worked as a wound care nurse, a quality assurance nurse, and assistant director of nursing. She earned her bachelor's at the University of Kansas and her teaching certification through the Kansas Department of Education, CTE specialized teaching. Daniel is the lead health science instructor at the Eudora High School and a certified nurse aide adjunct assistant for both the Johnson County Community College and the Neosho County Community College. She's a CPR instructor and is passionate about education and nursing. Like Jennifer, she enjoys assisting students on their path to a career in healthcare. So welcome to both of our speakers. I am thrilled that you're here. Now, our simulations, these are the first ever suite of web-based virtual clinical simulations targeted specifically to CNA education. And I'm going to jump into a brief demo where I can show you a little bit about how it works to provide context for the remarks that Jennifer and Danielle and possibly Celine will share. So each simulation starts with a care plan where you review the resident and get to know them. It's followed by a pre-simulation knowledge assessment, the simulation itself. Students then document the care they delivered in simulation, followed by a post-simulation knowledge assessment and a guided self-reflection where students can reflect on higher level questions about the care they delivered. Think of these as being similar to the kinds of questions you might ask students to reflect on at the end of a clinical day. So let's jump into the simulation. Here, this is a nursing assistant student character called Teresa, who's standing outside of Sophie Williams' door at the nursing home. So let's go ahead and knock on the door. There's no answer, so let's knock again.
Yes, come on in.
So this is Miss Sophie. She is the fictional older adult resident at our nursing home. Now, At this point, we don't need permission to enter, but let's go ahead and ask for permission anyway.
Privacy is always important. The good news is that Miss Sophie's already permitted you to enter. When you do, introduce yourself by name and title. It's her right to know who'll be caring for her, and it's just good manners.
So this is the nursing assistant instructor who provides real-time feedback throughout the simulation on decisions that students make, whether or not those decisions are correct decisions.
I'm Teresa Duran, your nursing assistant student during the shift.
A new nurse? What happened to the other one? Shanice, what was her name again?
So now the student has to practice communication and express how they would respond to Miss Sophie, who doesn't really know who she is or why she's there.
Shanice is a student like me. She's working with another resident today, and I'll be working with you so we can both learn. Nurse Johnson's supervising me and asked me to help you.
So let's try and comfort her by holding her hand.
This is a tough one. Your instinct to help Miss Sophie is excellent, but it's vital to wash your hands before touching her. Suppose you assist Miss Sophie before washing your hands. You could cause cross-contamination and create an infection risk.
Okay, I'll be right there. Just have to wash my hands first.
You know where I'll be.
And so this was a module with Miss Sophie. It breaks off into hand hygiene, ambulation, foot care, and side positioning. But I'm going to go ahead and introduce you to another character. This is Darna Cruz in a different simulation where Teresa has assisted her onto the bedpan. And now Darna is starting to feel a bit of short of breath. She has CHF and COPD, was recently hospitalized with pneumonia, and is now recovering at the nursing home.
Yes, I'm more short of breath. It's been worse though.
So now the student has a chance to measure Darna's respiratory rate. They would use their own watch and count her respiration. Let's go ahead and do that. So the student can start and stop the animation as often as they need to get an accurate count. And you might notice that Darna's nasal cannula is out of place. Later, we ask the student what they can do to improve Darna's breathing. And we offer them a whole bunch of choices that are completely outside the scope of a nursing assistant. And we include replacing the nasal cannula. So this is an opportunity for students to both learn about their scope of practice, but also help improve Darna's breathing. And so there is so much more that I could show you, but I just wanted you to understand the structure of the simulations. We have an older adult, we have a nursing assistant student and a nursing assistant instructor. The nursing assistant instructor gives real-time feedback. And even when you choose correctly, the feedback is still available. It's just optional. Nurse Johnson is still down here and students can listen to what she has to say. And with that, I'm going to stop sharing, see if there are any questions before I hand it over to our esteemed instructors. Okay. So let's start with communication. Jennifer, why don't you get us started? I'm going to stop sharing just so people can see you while you're talking. Tell us a little bit about how you helped to design the simulations to improve communication.
Sure. First, I want to welcome everybody. It's really great that you were able to make it to join us today. And this, I think the simulation is so exciting. And to me, it's like, gosh, I wish I actually could use it. I actually just retired, so I'm not able to use it with the students, but the idea of being able to go back and do that would be wonderful. Thinking about communication, when we wrote these simulations, and I think the biggest thing that we thought about was the students have such a hard time communicating. So they have a hard time in the classroom, in the lab, right? Because they're helping each other. They're trying to act like a patient. They're trying to act like a nursing assistant, but it's really difficult to get that to feel real or to act real, okay? So we spent a lot of time thinking what are the drawbacks of that. You know, what can we make? How can we make that better? And so the simulation actually has several different characters, as Charlie mentioned. When we think about the residents, our residents have different personalities, which I think is a huge benefit. They have dementia, some of them. Some of them are just angry at their situation. We have residents who come from different cultures. We have residents who are depressed. And so how, you know, when they communicate with Teresa, who's the nursing assistant, what does she say back? How we ask, you know, we ask questions that are like multiple choice questions that are indicative of what the nursing assistant should and should not say. So then we talk about, then Mrs. Nurse Johnson comes in and either corrects or agrees with what, you know, how well Teresa did. I think the other thing that I just wanted to mention is that when you think about communication, it's not just with the resident. You know, they're learning how to communicate with the instructor, and who is also a nurse. So our instructor in the simulations is a nurse. So they're learning that professionalism and also talking to somebody that's who is educating them. Danielle, do you want to take it from here?
Yes, welcome everyone. Just kind of going off of what you know, Jennifer said, we really thought about the communication piece, and you know, communication. There's so many pieces to communication. Communicating with the resident, communicating with Nurse Johnson, and that is a struggle. Looking at some of the things that my students always have a lot of questions about, it's always about communicating, and that's one of the things that they seem the most nervous about when we go to the clinical setting is communication. And the communication, you can build off of that in so many ways, because even just the communication of knocking on the door and introducing yourself, you know, and then you can look at how else does that affect the resident? Well, it affects residents' rights, the rights of respect and dignity. So we really try to take all aspects into consideration as we create the content and the dialogue.
I think that's great. Celine, do you have anything you wanted to add? I know I'm putting you on the spot. You don't have to add anything. We can
I
move.
agree. When we were developing these, is just what are the common mistakes that students make in any aspect of the learning process, and communication is definitely a biggie. I agree with that.
Excellent. All right, now we're going to talk about real-time feedback. So, excuse me. So let's go. Why don't we start with you, Danielle?
Okay, so with the real-time feedback, it works really two ways. And you're going to see real-time feedback when it comes to Nurse Johnson responding when a student doesn't select a correct answer. But there's always that option, like Charlene just showed you here just recently in the demo, that we can also do real-time feedback for when you do get a correct answer. Because one of the things that we talked through a lot was, you know, if a student chooses a correct answer, did they always get it because they knew that was the correct answer? Or maybe they were struggling with a choice and they chose that as the answer and they just happened to get it correct. Well, they can choose that learn more and then be able to see, okay, this is exactly why I did get this right. Jen, would you like to add anything to that?
I think that that is a really good point, in that some students will actually guess. You know, you have students that don't know the answer at all, and so they guess. So it's super important to encourage them to look at that learn more. And I think that students have a tendency, if they get it right, they don't go back. You know, why do I need to read about it? I got it right. But in that learn more section, we try to add a lot of extra details, some situations or some specific details that maybe you taught them in class, but they've forgotten, you know, or it was just kind of a thought in class, or they read it in their textbook and they didn't pick it up as something important, but it might be still in that learn more. The other thing about communication that I think, or group feedback, is that working with students, you know, when you are their instructor in clinical and you're the only instructor and there's 8 students out there, you have no idea what they're doing behind closed doors. You know that, right? So what is the simulation doing for that? And I love it because it's showing them, okay, if a resident acts this way, what should I do? If they say this, what can I do? I don't always have to, as a student, run back and ask my teacher. And I know you've experienced a lot of students that are very needy or very clingy. They're scared to be on their own. They're scared to be autonomous. But this gives them a chance to practice those skills and a chance to learn those skills. A lot of students don't have that. They haven't experienced that. This is their first career or their first, professional career, and they don't know what to do. So this way, they're practicing unique situations, things that are unique to them, not for us. We see this all over and over and over in a long-term care setting. The other thing I want to just mention is that what was important to us in the feedback is that not only did we get the correct answer with some feedback, but we also offered feedback for the wrong answer. So why was it wrong? But then also, what is the correct answer and why? Okay, so it's not like, oh, mark it wrong. Whoops, you got it wrong. No, this is why it's wrong. And also, what should you have done? And I think that's super important to help them learn.
I agree. Any questions so far in the real-time feedback?
I'd like to add to that,
Sure.
for the additional feedback that they get. Not all instructors teach the same way. Not all skills are done the same way. And this is another opportunity for students to learn that they can do the task correctly in more than one way. Some things need to be done, excuse me, lockstep, but there is some variability there, and this gives them a chance to learn that.
That makes sense. My favorite part of Nurse Johnson as the provider of real-time feedback is her personality and how she's an amalgam of all of our personalities, right? So we have, the kind maternal instructor. We have the, you should, we spent a lot of time trying to craft a personality that could be both like warm and fuzzy and affirming, while also being clear when things are incorrect and how an incorrect choice may or may not harm a resident. And so at least for me, one of the most fun parts of the real-time feedback has been trying to figure out, how do you give feedback virtually through a fictional character in a way that students really connect to that feedback. And we learned when we did our pilot last fall, and we had some images of Nurse Johnson where when she was giving negative feedback, she was frowning like, ooh, not good. And students were so hurt and upset that this fictional 3D character that doesn't exist in the real world was disappointed in them. And so we learned quickly that we had to be sensitive to just how vulnerable some students are, and remember that we have to be, even just the visual representation of a frown, despite positive or despite encouraging feedback, could cause discouragement. So now Nurse Johnson never frowns. I think Celine, was that your class that had that problem, or was that Danielle? Was it one of you?
It was my class.
Okay, well, let's talk about safety. When Celine did her thesis, I think 92 or 96% of students, Celine did her thesis on CNA Simulations. More than 90% of students felt like the simulations helped them be in a position to better keep themselves safe. So why don't we talk about safety, both from the perspective of safety of the nursing assistant, but also the safety of the resident. Who went last? Was that Jen? Are you up, Danielle, or are you up, Jen?
I think it's my turn.
Right.
Okay, so back to safety and the students. I'm going to go back to what I was talking about before, and that they're behind closed doors, when you're in clinical. And I know that how many times do your students forget to put the bed up for their own safety? Forget to put the bed down when they're finished, and they just walk away from the bed. They know they're going to get some water and they go and get it. And the patient's way up high. Forget which side rail. You know, they have side rails up and down. Should they be down? Should they be up? You know, what's safe versus what's considered a restraint. And we also hit, I think that's super important, is we get very detailed in things like the water temperature. You know, how are you going to check the water temperature? Who has to check the water temperature? And then based on where you're coming from in your school and how you teach it, maybe you're using a bath water thermometer versus how I do it, and that's feeling the water temperature. But so we make sure we include that in Nurse Johnson's feedback. So they hear, we've tried to hit things that aren't just one or two or three of us, you know, what our background is, but also where you're coming from. So another thing is HIPAA. We can't forget HIPAA. And we mentioned HIPAA, we talk about it, we talk about confidentiality. Where's the best place to talk, you know, about a resident? And they use, you know, we're using a documentation system. So that's important. You don't always think about that, you know. And I think the other thing that I like, that I think is real important, are things like tripping hazards. As an instructor, you may not always think about that. You know, okay, they got up from feeding somebody, but did they move the chair back out of the way so nobody trips over it? Or, you know, was something spilled on the floor? Well, you can't just leave it there. You have to wipe it up because it causes a tripping hazard. So even little tiny things like that, we try to fit in and address those safety issues. Danielle?
Yeah, I mean, when you talk about safety, we talk about safety on so many levels. And again, it's not just about resident safety, but it's about staff safety also. And sometimes the staff, you know, I know for my students, don't even think about, oh, the staff have to stay safe too. And it's, yes, we have to take care of ourselves in order to care for the residents. And so, you know, really addressing that in these simulations is important. And just like you had said, you know, you definitely want to raise that bed up, protect your own back. That's one of the biggest mistakes that I see when we do skills, or even when I'm assisting students, you know, at clinicals. And it's just one of those simple things that's easy to forget, but at the same time is going to save your back, save your energy. And then again, making sure, like you said, putting that back down and really addressing things. You know, one of the things I get from students a lot is when it does come to their own safety is that infection control piece. And students don't think about all the things in a facility that we touch. And, you know, when do we put on those gloves? When do we wash those hands? And sometimes, you know, it seems like we're sanitizing and washing hands over and over and over again, but really thinking about, if you just did this, why should you not touch the bed controls? Why should you not touch a residence item? So really just addressing safety concerns from all aspects. And I think that's pretty key for our students and for our residents. And, you know, even in one of the simulations, we look at safety from, you know, we have a resident who is missing her son and she's depressed and she's making comments of, you know, towards really not wanting to be here anymore. And that's a safety concern that sometimes we don't think about being safety, but it is. And how does the CNA student or the NA student address that? You know, how do they report that? You know, when do they take that concern to the nurse? So really looking at when there are those safety hazards, what to do next. So, and that kind of plays into communication and to critical thinking and real-time feedback. All of this really just kind of plays upon one another.
What I'm hearing is that you're crafting stories and designing stories in ways that present challenges that essentially force students to make real decisions about their own safety, the safety of residents. And that's just part of the design. I love it. So when I talk to instructors who are exploring CNA simulations, these two words, if I were going to choose two words that I hear more than anything else in the world, it's critical thinking. My students struggle with critical thinking. Oh, this might help their critical thinking skills, critical thinking skills, critical thinking skills. So talk to me about critical thinking skills.
Okay, so I'll start with this one. Critical thinking skills, we're always looking as we're creating the dialogue and the simulations, we're always looking at how to help students think critically, how for students to take care of a resident, but at the same time, be able to assess and know when, do I report this to the nurse now? Can I report this to the nurse later? Can I make some decisions? Are there some things that I can do that will fix the situation? One of the things that Charlene had mentioned earlier in the demo was with Mrs. Darna Cruz and the fact that she gets short of breath. And, we hope that the students notice that the nasal cannula is out of her nose. And by assessing and using critical thinking skills and putting that back in, we're going to be able then to help the resident. And just being able to, and I think critical thinking is one of those things that we have put a lot of thought and we've built a lot into. And it's one of those things that students are going to develop. I mean, I think we all develop our critical thinking skills on a daily basis. We're always learning new ways to do things. We're always learning how to do things, better. And but we do put a ton of thought into these scenarios and how can students get those critical thinking skills? And there's several opportunities in there. And as instructors, kind of like what Jennifer has said, when you take students to the clinicals, and depending on which state you are in and how many students you can take to clinicals, you can't be in the room with every single student every single time. So, you want to help prepare them as much as possible and know what to come out to and report to you, when to get you, and what to be able to say to that nurse. So we use a lot of, in our scenarios too, in our simulations, we use some free text boxes, and that allows the students to give a report to Nurse Johnson. And basically that then allows us as instructors to be able to go in and see, are those students using their critical thinking skills? And if they're not, where as instructors can we help them develop those skills even more? And so we really work hard on those critical thinking skills. Jennifer, do you have anything you would like to add to that?
I'm actually going to piggyback on what you just said and talking about the free text boxes. I think a huge piece of that is, we do have a lot of multiple choice, but the free text gives that student that chance to think on their own. They're not just picking an answer or guessing. So I think they're really important. Now, we have had instructors that say, hey, I don't really want to grade all these or read all this. So also when we write the questions, we also are trying to write them so the student doesn't have to answer in a paragraph. It could be bullets. You can direct that. You can say, don't give me sentences, give me bullets, give me the highlights, 2 or 3 words, however you prefer. Maybe you want them to write sentences because you're also working on, their skills in, grammar and things, but you have that option on how you want to direct that. And when you think about critical thinking, it can be as simple as, what supplies does the student need to go in and do a bath? How many times do they have to run back out and get something they forgot? It's not all going to be there, especially in a long-term care. They don't have a lot of supplies in the rooms. And can we get them to the point that they can remember how many towels and how many washcloths they're going to need? All right. I mean, I've had students who start from scratch. They go get all new bathing, a bath, a basin, soap, lotion. They start from scratch. And I'm like, did you look in the drawers? No, I didn't think about that. So those are even just really, really, really basic things. And then up through, we have a resident who, Mr. Wright, who's had a stroke. And Teresa walks in, the overhead table is on his flaccid side. Does she notice it? We put that in there. Is she going to notice that? Is she going to notice what side of the bed that she's supposed to have him fill the water? So she has to make that decision. And he even has to remind her at times. So then, she's like, oh my gosh, I should have known that. It was on the care plan. Why didn't I look at the care plan? The care plan is super important. It helps with those critical thinking skills. It helps the student, or it helps you reinforce that you need to know something about these residents before you walk in the room. You can't just go in and say, oh, I have an 87-year-old female and be fine with that. No, there's a lot of things about these residents you need to know and plan for, or maybe plan for, or be ready for the unexpected. And that's what I think is super, important. I think we've really tried hard to put that in. And it's, when you think about the whole simulation piece, we're all instructors just like you. We didn't come from, a degree in computer science to make these simulations. We're nurses and we've worked with nursing assistants, and now we're teaching nursing assistants, or teaching those that haven't been, of course, in the medical profession. I always tell my students, it's like a whole nother language. You might feel comfortable because you've worked 3 jobs in your past. This is completely different, so those critical thinking skills, I think, are on top of our list.
That makes a lot of sense. Thank you, Jen and Danielle. One thing I like about the design is how you introduce these situations that are difficult, right? Danielle mentioned that Mrs. Rogers was feeling suicidal, or we might have Teresa discover a foot ulceration that nobody knows about, just to figure out what to do, how to handle it. So it's a little bit different than just going through the steps of the skills. You just encounter problems and you have to figure out what to do and how to respond. That's one of my favorite parts of the simulation. I'm going to pause again and see if Beth, Rebecca, or Celine have any comments or questions before we move to the next topic. All right. Well, after critical thinking is student confidence. Talk to me about student confidence.
All right. Sorry, I couldn't get it unmuted.
Mhm.
Got it. So I know I teach or taught in a high school setting. So we all come from different settings. We have high school students, we have college students. One of my biggest problems, or one of the biggest concerns of the student, is how am I going to go to clinical on the very first day? I can't even walk in the room. Okay, I knocked on the door, but now what? I can't talk to them. And they get so nervous. They start hanging around me, and I said, well, have you gone and introduced yourself? Well, no, I don't know how to do that. Sure, sure they do. They know that their name is, they know what they're there for. And in practicing at clinical, in your lab, it's just not the same, is it? Working with each other, your peers, you can't make that up in your lab. So I think that after they do a couple of simulations, the good thing is they can retake them over and over and over. You can decide, do I want to assign them as a grade, or do I want them to just practice? I would assign them, personally, I think they are most useful if you assign them without a grade to help build up the students' confidence for a while. And then maybe when you get close to your CNA certification date, your testing date, then you start maybe giving them a grade for it. So they really buckle down and look at the specifics and take it seriously to get ready for that test. That's how I see it, being most useful when you think about the grading. The other things are things like being able to feel confident in, okay, these are TED stockings, but all I know is that they're TED stockings. I know they squeeze the legs. I know they're good for blood clots, but they come in different sizes. I didn't know that. And you mentioned that you talked about it in class, right? But what happened? They forgot all about it, or they've never had the opportunity to measure a resident's legs to put TEDs on. So we make sure, we go back and talk about the real-time feedback and things. We're giving them the opportunity in the module to actually measure the legs. And can they get it right? Can they look at the chart and figure it out? And then while they did it on the simulation, now they might get a chance to do it in their clinical practice or clinical setting. How exciting is that, right? To build their confidence. When a student comes out and they're so excited because they get to do something for the first time that they've never done before. So that's always just melts my heart. It's so exciting to see them. So Danielle?
Yes. So I'm kind of going off what you said. I think one of the most wonderful pieces and one of the things that I've enjoyed the most about building these simulations and kind of how I got involved in helping create these simulations is I was looking for simulations for my students because, we do a lot of things in lab and getting the students to the lab and, them working with their peers and then actually getting them with real residents and with other CNAs or other nurse aides is a little bit different. And so confidence is always a big piece for my students. And I teach both high school learners and adult learners. And so they come from all kinds of different backgrounds, levels of experience or no experience, and of course we all know that communication is a little different these days. We do a lot of communication through texting and social media and Zoom meetings. We do things a little bit different now. And so especially for my high school students, really just building up that confidence. And this kind of allows them to, to build that confidence when they select the right answer and Nurse Johnson, gives them a congratulations. She says something outstanding to them, or maybe they don't pick the right answer and she tells them that's okay, you'll get it next time, and explains why, they didn't, what they did wrong and what they need to do right next time. And I think it really allows the students to, and we've really focused on allowing students to become confident in things and then knowing what they're not so confident in. Because, there are a lot of things that we teach, but they may not see much. One of the things we don't see a whole lot of anymore in long-term care is catheters. And so knowing for students to, okay, I've had some experience with this. I've done this in simulation. I hope to get to do it in the clinical setting. But if I don't, I know this is probably something I'm not 100% confident in. So I know that when I do get out there, to be asking for some more assistance on this. And really also, when you get to that clinical, you're going to have students who are a little more confident and little students who maybe aren't as confident. And those students, I think this really helps them to determine when they need your help and when they don't need your help, because they really get to practice those skills through our simulation and get that real-time feedback and become comfortable or still not so comfortable. And kind of allows us as instructors to know that. So
it sounds like building confidence is part of the design as well, like how you structure the opportunities. And we had one instructor in New Orleans with the New Orleans Job Corps who said that she barely recognized her students when they showed up at clinicals after doing the simulations. They walked in demanding the care plan and like confidently walked into the residents' rooms, and she'd never seen that before in her life. They felt ready, and I think that's a huge benefit of how you design the simulations to really build that confidence. I want to give Celine and Marilyn Cooper just joined us. Both she and Celine were on the team previously in helping design the simulations. Marilyn, could you tell us a little bit about what you think of the simulations in the context of students with disabilities? So Marilyn teaches specifically students with disabilities.
Well, so far, hi everyone. So far, the student that I have, she just started on Monday, and she's really enjoying working with the simulation. So she has completed one whole, now so we got to pace ourselves, but she has completed one whole one. And she has enjoyed it because she gets that interaction and confidence with people with disability, not just students with disability, but any student is very important. And so she was doing Miss Rogers.
Mm-hmm.
Yes, she loves Miss Rogers because she has a Southern accent. And she just thought that was just too funny. And she just loved to hear Miss Rogers talk. And she really enjoyed doing that simulation. And to my surprise, with her just starting, she made like 100 in resident rights. She scored pretty high on communication. I'm seeing her skills building even just by doing the simulation. Because she's pretty quiet and reserved, because a lot of students with disability, they don't talk because they're afraid of getting it wrong or not being right. And so by her doing the simulation so far, she is engaging and she is enjoying it. So yeah, just with her, I have seen a major difference. And I think she started not on Monday, but maybe Tuesday. And she have finished one complete module. And I said, you know, we're gonna have to pace. I said, but the beautiful thing is we can go back. And we did see an increase in her between her post, her pre and post. You know, afterwards she scored, I can't remember the exact score. I want to say she passed it, but I know her beginning one was 43%. And I think the end, and I can't remember the exact number, but it was definitely higher after she got to the end. And even with some of her responses, and you know, writing is not one of her strong suits, and she was able to her the best of her ability to write response that a lot of them I gave her 100, gave her full credit. It was a few I didn't, you know, and maybe a couple I gave her a half credit, but she did really good because she was really focusing on. But I think Miss Rogers was her favorite one because she really, I was in the room when she was doing her, and she was just like, wow, she really talks different. I don't know why, because in Arkansas, we all have a draw. If you don't have a draw, you from another country, I mean, from another state, so. But she was like, wow, she really talks different. But we enjoyed Miss Rogers. That's my take on so far. My other student, she is a high school student and she hasn't started yet. And so hopefully next week we will get her started with the first, what is it? I think it's in the thing, it's a module, is it a simulation? I think we calling it a module, right? Okay.
Wonderful. Thanks for that real-time experience. Like, it sounds like your student's doing the simulation now, and we're hearing right now about her experience. That's wonderful. Thank you. Celine, do you have any final thoughts?
I had to postpone my LNA class, LNA in Vermont class for the fall. So I will be using the modules when we start in January. So I am really psyched about the feedback that I have gotten this afternoon, and really anxious to use it with my students in January.
That's wonderful.
Go team.
How about, I don't know if Beth and Rebecca, as I know Beth might be using them soon, but do you guys have thoughts or questions? You have this treasure trove of experienced CNA instructors who help to create the simulations. This is a great chance to ask questions about like the design, but also how they're implementing, how they're using them, just anything at all. This is
I haven't started yet. That's why I keep listening to these, getting ideas and, you know, feedback, because I will start using them here in the near future. So I'm just trying to get a feel for how they're working, and, you know, just any information I can glean from listening to your conversation. So it's very helpful.
Oh, that's wonderful. I can't wait for you to get started.
Yeah, me neither. I'm looking forward to it.
Oh, wonderful. Any other thoughts or questions? Rebecca Thomas? If not, I'm going to announce that we are going to try and do these more regularly. So next month, Thursday, September 29th at 4 p.m. Eastern. That's I think we've got every time zone represented on this call. So 4 p.m. Eastern, 3 p.m. Central, 2 p.m. Mountain Time, and 1 p.m. Pacific Time. We're going to talk about documentation and how our documentation module is one way that we can help teach nursing assistants about documentation through simulation. I'm going to take just a moment and show you. It wasn't a part of my demo, but we do have the opportunity for students to document the care they deliver in simulation. And so, for instance, with Miss Sophie, we help her with mobility. You can, you know, document that we help her out of bed to chair. We used a gait belt. She traveled a distance of 10 feet. And whatever it is that the student did in simulation, they're able to document that at the end of the simulation. And
Excuse me,
look-
Charlene.
Yeah.
I'm sorry, we can't see that screen. It looks like it's in the back of the
Oh,
screen you're showing.
uh-oh. Okay, hold on. How about now?
Yes, that's good.
Thank you for letting me know. Okay, so this is documentation. I was just showing how, as an illustrative example with Miss Sophie, we helped her with getting out of bed to chair using a gait belt for a distance of 10 feet. But no matter what happens in the simulation, students have a chance to document it. And one thing I keep hearing from instructors is how hard it is for students to document at the facilities during their clinical rotations. So we're going to have our own session on teaching nursing assistants documentation through simulation next month, September 29th in the afternoon. I am so grateful that all of you joined. Oh my goodness, we have someone who's joining the meeting right now. Let's see if she has any questions before we end the meeting. Hi there. Hi, Sharon. Can you hear us? I don't know if she can hear us. We were just wrapping up. We're so glad that you joined, and we will be able to send you the recording. But do you have any questions you'd like to ask this team of CNA instructors who helped design the simulations? You're on mute.
I don't really have any specific questions other than the fact that when I was looking at this program, I was wondering if you were ready to release it and the cost.
Oh, it is released. There are 25 schools using it across the country, and the cost depends on the number of simulations you purchase and the number of students you have. So I can follow up with you on a phone call or a video call, and we can walk through the different modules. And if you would want all of them, if you would want one of them, we can sort of look through and see what would meet your needs, and then I can give you a quote. But yeah, they're out in the world. They're already being used.
Okay, very good.
All right, I will follow up with you by email for us to find a time.
Sounds good. Thank you very much.
And thanks for joining. And thank you everyone for joining, and shout out to Danielle and Jen for sharing your behind the scenes insights. I'm going to do a little Zoom reaction here. Oh, that's the wrong reaction. Okay. And thank you to Celine and Marilyn for your contributions. Loved having you on the team. Welcome. You're welcome back anytime. Beth has left, but Rebecca and Sharon, thank you for joining, and we can't wait to see you next month. We're having another session on September 29th, where we're going to talk about teaching documentation through simulation. All right.
One more thing, don't forget to ask the other instructors in your school or in your cohort, if they may be interested in hearing anything about this. It's so nice to hear bits and pieces so you can, see what you're if you're thinking about it, what it's all about. So.
Yeah, I've worked with simulation quite a bit as a nursing instructor. So it would be nice to be able to offer this to CNAs.
Absolutely. Absolutely. Okay, well, it's Thursday, so it's almost the weekend. So everybody have a wonderful weekend. Thank you again for joining. Bye, everybody.